Okay, everyone, welcome. Thank you for joining us today. So glad you're here with us. We have our July Echo session today, Disability and Healthy Relationships Echo. While people are still joining, I'm going to go ahead and get started just so that we're mindful of time. But I'm so glad to have everybody here. Um, as I'm getting started, if you want to put your name and contact info in the chat, tell us a little bit about you, what organization you're from, what state you're joining us from, because we have people from all over joining, and we want to get to know everybody in here. So share a little bit in the chat, please. Um, as you just heard, we are recording the session, so just keep that in mind. If you're sticking around, we're assuming you are okay with being recorded with us on this session. Also, we want everybody to participate. This is a community of practice, so we're hoping to learn from each other through this session. We have lots of different people from different backgrounds and different areas of the country that are joining on these sessions. So we really want to hear from you and your experiences. While we're having our training, if you can, if you have thoughts or questions, you're welcome to use the chat. I'll be watching the chat so we can bring things up as needed. You're also welcome to use the raise your hand function of Zoom to, have a turn to speak if you would like to during that. And then also at the end, we'll have time for discussion as a group. So we love to hear from everyone on the call. As you are sharing experiences, please just make sure that you are protecting individual privacy. If you're sharing about other people than yourself, just make sure that you're protecting their privacy, please. And like I said, we have a few different parts of an echo session. They're all important and we love each of them and we get to learn from each other through them. So like I said, we are a community of practice. We want to get to know and learn from each other on this session. We will have a didactic speaker who will be presenting some specific information. And then after the speaker, we'll have some time to discuss as a community some questions related to the training today. So stick around for all of it because it's all so great. If you have, like for future sessions, if you have some specific questions or a specific like situation or case that you would like to share with the group, we would love that. So feel free to reach out to me if you have questions about that and if you would like to set that up because we are here to share and discuss things together. In addition to sharing your information in the chat, if you would like to, you can rename your profile so that it's just quick and easy for everyone on the call to see who's with us and where you're joining us from and all of that jazz. So this tells you through the participants icon, you can do that. And some information on how to raise your hand, also through the participants icon. Probably we've all done that multiple times in the last few years, but if you need that, that's how you can do that. Okay, so today's topic is disability and sexuality addressing professional bias. Today's presenter is Morrigan Hunter, who has an MA and MSW, and their pronouns are they. And Morrigan is a queer disabled social worker. Faye has a background in research and sexual and reproductive health promotion for people with disabilities. Fair Work centers on disability justice and trauma-informed care while centering the autonomy and lived experiences of the disability community. And Fair joining us from OHSU. We're so excited to have you. We're happy for all of us to be here. Thank you so much. And I'm just going to go ahead and stop sharing my screen and turn the time over to you, Morgan.
Thank you, Lindy. All right. Hopefully my screen share still works. All right, so this is Disability and Sexuality, Addressing Professional Bias. All right, so first I'll just go over an agenda that has we'll go over if you want to introduce yourself. I know that a lot of you already have, so we can skip that if you already have. I'll talk about some group agreements. Then I'll go over what professional bias can look like in sexual health for people with disabilities. And then we'll cover some ways that this bias can cause harm, and then some strategies for addressing this bias. And then finally, we'll get to any questions that we have. All right. So as Mindy said, I'm a disabled social worker. And I work at Oregon Health and Science University, but I don't live in Oregon. I actually live in Chicago. And I'm also students starting a public health PhD at Indiana University. I started out doing community organizing for survivors of abuse, and then I gradually moved on into doing more research and education. So I'm coming from this from sort of a community organizing perspective, as well as someone with my own lived experience as a disabled person. Identify as disabled, queer, white. I'm in my late 30s, currently pregnant with my first child. They live in Chicago with my two partners. So if you didn't already get to introduce yourself and you want to, feel free to add that to the chat if you would like. Some group agreements, and this is because I do like to have interactive like workshops. I think that that's oftentimes more helpful for people. So feel free to turn your camera off and do what you need to do to be engaged. Speak your truth responsibly and listen to understand. Be willing to do things differently. That might mean experiencing some discomfort, but please let the organizers know if you have any unmet access needs. And then like while I will be presenting on some of my research, like kind of like my approach to teaching is sort of the idea that from popular education, that the term coined by Paulo Freire, is that I'm not here to give you all the answers, but together we can come up with sort of like potential solutions to things. And I want to acknowledge that might cause discomfort. Accept non-closure because we do have limited time together. And confidentiality, share lessons but not stories. Respect, treat others as they wish to be treated, make room for quieter voices, practice curiosity, we're here to learn from each other, and finally acknowledge the power dynamics in the space, which is also part of why I'm transparent about my own identities in this place. All right, so to begin with, what is professional bias in sexual health for people with disabilities? Or what do I mean by that specifically? So, I think back to like when I was getting my MSW years ago, I had a professor say to me that the way that we do things matters. It's not just kind of like what we're doing so much as, but also the way that we're doing it. And I think that when I think of professional bias, I think oftentimes, um, that can really show up in the way that we're doing things. So, for instance, like the way that we do things can be influenced by our values and beliefs, and everyone has values and beliefs. And in this case, we're talking about disability and sexuality. For example, one belief that a person could have might be that sexual activity for people with disabilities is risky or is likely to lead to harm. And if I believe this, then I might think that the most important, reason for providing sex ed was to prevent harm, or maybe like to prevent someone from engaging in illegal activity, things like public masturbation, things that might get them in trouble. So that's sort of like an example of like ways in which like our own kind of like personal beliefs about sort of like what's most important might influence like the work that we're doing and how we're showing up, or like what we think is kind of like most important. So take a moment to reflect on what you feel is most important in sexuality education for people with disabilities. What values are influencing those priorities? Feel free to share if you want to, but also if you're more comfortable just using this as sort of like a personal reflection time, feel free to. But yeah, if you want to unmute and speak, feel free to do that or add to the chat. All right, I see something in the chat. We have empowerment and choice. Are those, and we have self-determination. Yeah. So are these what you're seeing as kind of like the values or what you feel is most important in sex ed? I believe access to quality and developmentally appropriate sex education is important. Education, access to information that individuals with disabilities are often excluded from. What is most important in sex ed for the empowerment and choice and freedom of choice and expression. Thank you, everyone. And also, like, feel free to unmute if that's more accessible for you to speak instead of the chat. Value influencing is feeling strongly about equity and access. Oh, I'll wait just a little more to see if anyone else has anything they want to add. Safety and security. Everyone should show up as themselves. Well, I don't think it's most important value-wise, abuse prevention is critical. All right, I will move. Oh, and sex ed, an understanding of how bodies work and pleasure without shame. Thank you, everyone. I'm going to move on. So I mentioned that I'd be talking about some of like my research. This is like an upcoming book chapter that I have. I think it's on my pre-order now. I think it'll be available in September. But it's a book chapter that's called Envisioning Better Futures in Sexuality Education for Disabled People, a critical analysis through the lens of disability justice and the neurodiversity paradigm. That is a chapter in disabilities, pleasures, and sexualities, transforming perceptions, cultivating desires. If you want to look that up. All right. So some of what I'll be sharing is from the is sort of like is from that chapter. So if you want to kind of like read more about that, you can access that once it's out. Um, so for this chapter, I analyzed 18 articles about either like the development or the implementation of sex ed for people with a range of different disabilities. I was searching specifically for articles that were sort of describing either the process of developing sex ed or kind of coming up with like content that should be in sex ed, or about the process of like implementing an existing curriculum. And one of the things that I was really interested in is what the authors described as the reason for offering sex ed, because they generally would offer a reason kind of in the beginning of the article as far as like why they're doing that work. Um, and then also the other thing that I was really interested in is what kind of content they were describing as being kind of like important in the sex ed that they were offering. Okay, so the rationales for sexuality education. In general, the authors named like I'd say like one of two kind of like issues, and sometimes it was a mix of both. Um, they most of them other kind of like named some what I call it external factors like stigma around sexuality. Sort of this idea that well, like people with disabilities are not receiving this education because of stigma about disability and sexuality, and so that's why we need to provide it because it's just not being provided. The other thing that I saw that I'm kind of calling like a personal factor, was sort of like or an internal factor, as some of the authors were attributing the need for sexuality education to sort of like just the person being disabled and having kind of these sort of like disability related deficits, and that was the reason why sex ed was needed. And so some of them I think mentioned kind of like both of those factors. Some of them it was like one more than the other. But what was really interesting, and me as an autistic person, this is, I think, particularly interesting, since this was relevant to my own community, was that the articles that were about sex ed for autistic people tended to place more emphasis on personal deficits, attributed to being autistic, than sex ed that was made for other disability communities. And I'll talk a little bit more about this in a bit and some of like my ideas for why this might be the case. And maybe some of you will have ideas for like why that is, but I think that was really interesting in doing this sort of like cross disability analysis of different sex ed uh, kind of like implementations and developments and seeing kind of like how there is sort of a difference in attitude toward why sex ed is needed. All right, so getting to the content of what people were describing. So I had 18 articles, 12 of them covered risk reduction of things like sexually transmitted infections, risk of abuse, unwanted pregnancy, public masturbation, etc. So really like kind of like a heavy emphasis on risk reduction. 9 of them covered relationships or how to develop a relationship. 8 of them covered puberty, anatomy, and hygiene. 7 of the 18 had content about LGBTQ experiences. 4 of them addressed topics related to ableism and self-perception. So that kind of gives like a breakdown of how many of them are covering what types of topics. Another thing that I was looking at is did articles describe any involvement of the disability community and to what extent? None of them disclose the disability status of the authors themselves, and so that I don't know. Only 2 of the articles describe people with disabilities contributing to deciding what should be taught and how it should be taught. And so that felt kind of significant to me. I think that there was which doesn't mean that the others that they might have involved the disability community, but they didn't describe it in their methodology, which seems pretty significant to me that that was oftentimes not happening. So for our next discussion, what effect do you think the relative lack of involvement of people with disabilities might have had on these studies? For example, such as the rationale for teaching sex ed, or the content of what should be in sex ed. Do you think the rationale or content would look different if more disabled people had been involved? And I can go back and kind of like share like the results again if you'd like to see that. So I mentioned kind of like there's two kind of like two rationales for sexuality education, like or purposes for sexuality education. The kind of like either the external factors or the internal factors, with kind of like sex ed for autistic people being particularly attributed to sort of like personal factors. The content of the sex ed, and then 2 of the 18 articles describing people with disabilities being involved. So any thoughts here?
I'm unmuting. I'm gonna be brave here. Um, that a lot of times it's risk reduction instead of making connections
Yeah,
and just overall quality of life outcomes, right?
yeah. And that's kind of like speaking to the first bullet point here as far as kind of like what the effect of kind of lack of involvement of people with disabilities.
Yeah, I think it impacts the rationale too, right? If
Mm-hmm.
you're creating things to prevent um, or try to avoid risks, then that is just a different tone and a different approach
Mm-hmm.
versus if you're creating curriculums and guides to help facilitate connection and increase those opportunities. It's a different tone, right?
Yeah. Yeah. I think I saw something in the chat, which I will read out. I think that one of the issues is the same as a lot of anthropological research, where the researchers are looking from the outside in. It lacks the perspectives of the people directly affected. Yeah, I would agree with that. Do these results surprise anyone that this was kind of like what I found when I was looking for articles on this topic, as far as like the breakdown of content or anything else? Unfortunately, no, it does not surprise me. Yeah, I think the one thing that did kind of like that I found kind of surprising was like the I'm sorry, my rabbit's being noisy. Um, the one thing that did kind of surprise me was just that there was the sort of the stark difference between the emphasis on sort of like personal deficits with sex ed for autistic people. I hadn't seen a lot of studies that were really comparing things cross disability before, but that really kind of stood out to me. But yeah, the rest of it I would say did not surprise me either. Any other thoughts on this? Or like thoughts about kind of like um what this might look like if more disabled people had been involved in kind of in these efforts. I think scroll up. I think discussions on curiosity, exploration, acceptance, humanity are probably relevant as well. There's a surprising need to talk about relevance and equality. So you're saying that that those sorts of things are important and needing to kind of include them in sex ed, is what you're saying, Greg? And Grace says, can you specify what defects emphasize relate to autistic learners? So it would generally kind of like use like the language from the DSM and sort of say like as we know, kind of like there's sort of like core deficits of autism and that kind of like I think it usually like related to like social issues and things like that. Basically, they would just sort of like list out sort of a DSM kind of definition of autism and say this is why autistic people need sex ed, which is really interesting because I didn't see that sort of thing so much with other disabilities. Like looking at, I think I found like quite a few that were for like intellectual disability, for example, and I didn't see that same explanation. I think I found it in like there was one article that I found that was on sex ed for young women with Down syndrome that also kind of like had this sort of like deficit based approach, but it was the only one that I found for that population. But it was very consistent with like the sex ed for autistic people. I think like all but one, and that was the one article that actually involved autistic people in it. And he says, I am surprised that consent wasn't directly addressed in any of the studies, although maybe it was included in some of the topics. Yeah, I think it would have been in like I think I mentioned kind of like one of the categories is sort of like relationships and healthy relationships. I I I didn't like kind of like the way that I kind of like characterized it and didn't list consent as like a separate category, but I also don't have access to the full curricula of all of these. It was just kind of what the authors were describing as kind of the content. All right, a couple more comments. I'm surprised. Okay, already had that. I think it's because there is so much attention on social skills and correction in the autism services world to begin with. It's deficit focused all the way down. Yeah, I'll get to this a little bit, but that's kind of like that'd be my thought as well. Is that there's something yeah, that there's something kind of like specific with like the sort of like autism services industry, but it was really interesting to see how it showed up in sex ed. All right. Any other thoughts before we move on? All right. So what are some of the ways that this bias can cause harm? So I think we're kind of all talking about these things, but bias and ableist assumptions. So ableist biases can influence ideas about what is most important in sexuality education for people with disabilities. So consider how many of the articles, 12 of the 18, addressed risk reduction, while only 4 had content on self-perception as a person with a disability and ableism. I think that says, to me, that says so much about what the authors are feeling is important or not important. And um, yeah, I think it's it kind of speaks for itself, I think, but only 7 of the 18 articles include LGBTQ experiences. It's less than half. And that's also pretty significant. No articles identified pleasure as a priority. And I think there's probably a lot of other things you could say about this as far as like what they are or aren't covering, but let's see, there's a comment in the chat. I have a question out of the topic. One of my clients is disabled and she tried to apply for disability, but she got rejected. What she has to do. Oh, yeah, I'm not really an expert on that, so I don't know if I can help you, but maybe somebody else can. I'm sorry to hear that. All right. I'd mentioned the issue of how like sex ed for autistic people was kind of framed a little differently. So um the articles about sexuality education for autistic people overwhelmingly framed the need for sex ed as a result of what they were calling core deficits. And they would oftentimes kind of like name like the diagnostic and statistical manual of mental disorders and kind of like that the sort of like language of how they describe the disability in there. Articles on other disability populations referred more to the lack of education caused by social stigma as the need for sex ed. As compared to the articles for autistic people. And we kind of like discussed this a little bit, and there's it could be potentially kind of like the reason for this might be sort of like the autism services industry potentially. Um, I I don't know if there's a way to kind of like share my slides with participants afterward, but I have like a bunch of links in here. And one of them is to this article on the autism industrial complex. If you're not familiar with that, I think it's kind of like helpful to kind of like read about. And I think that was kind of like what was being referenced earlier was sort of like the autism services industry being like sort of deficit focused. But I would guess that this probably plays a role because the authors kind of lay out how the disability service industry is sort of, they exist to make a profit off of like fixing autistic people and fixing in quotes. And that might play a role in why a sex ed for autistic people had more of this deficit focus. Another thing that I think might be part of it is that like societally, like I feel like there's kind of a fascination with autistic relationships and sexuality. For example, like the show Love on the Spectrum. And I imagine that some of that plays into this particular kind of excuse me, this particular sort of like idea that being autistic means that there's something sort of like wrong with your capacity or your ability to have relationships. I mentioned that I'm autistic myself, and I would say that I found that people oftentimes react with purient curiosity or incredulity when they discover that I have relationships. For instance, they might assume that my partners are my children or that I'm their child. And so just from my own experience, I've seen this there's oftentimes a lot of misperceptions about autistic people's capacity to have relationships. And I'm sure that all of these sorts of things are impacting why sex ed that's made for autistic people has this sort of deficit focus. All right, roots of biases. Okay, drink of water first. All right, so biases such as these are often rooted in the idea that sexuality for people with disabilities is inherently problematic or dangerous, as well as the idea that people with disabilities cannot be LGBTQ plus. As I mentioned, like less than half of the articles named any kind of like inclusion of like LGBTQ experiences, which is, I think, a pretty big omission because it means that a lot of their students are not going to see themselves or like won't see other people, who are in the classroom or in their lives represented in the curriculum. And that's seems like a pretty big omission. And well, it's true that people with disabilities do like have like high rates of abuse. I think it's kind of important that abuse prevention that when there's like this focus on abuse prevention rather than comprehensive sexuality education, I think it does little to actually address the systemic factors that contribute to abuse. This is something that I've done a lot of like work around in the past, and um, is something that I'm kind of planning to kind of like continue with my PhD. But I think that there's oftentimes a lot of like focus on not just restriction and control, but also sort of like the when I see a lot of these studies like the ones that I mentioned, where there's this overwhelming focus on like risk reduction, to me, it feels like it's sort of missing the broader picture in which this abuse happens. And I'm saying this both as a disabled person who's experienced abuse and also as a researcher who's interviewed other survivors with disabilities. And that's something that I'm really interested in. And my work is trying to look at these sort of like larger systemic factors um, that are kind of contributing to abuse rather than just saying that abuse prevention can be something that we can teach you, because it's not the disabled person's fault that other people are harming them. So, what are the consequences of these biases? So when professional biases go unexamined, it becomes more difficult to interrupt ableist harm. Students with disabilities may start to believe these things about themselves. They might believe that sexuality is inherently more dangerous for them, or that they shouldn't have relationships if people are telling them that it's not okay. They might not have adequate information to lead empowered and fulfilling lives. This might be particularly the case for LGBTQ students who might not even get to learn about people like them if the education that they have doesn't include that. And I mentioned none of the articles mentioned pleasure as a priority. And to me, that is really, really, I think it's really unfortunate, because I think that it's hard to really teach consent without teaching pleasure. This is a term that like I've referred to as like pleasure as prevention, but it's something that I've in my own work that I think that centering pleasure in conversations about consent and about boundaries is really important. But I can talk more about that if you're interested later. But I think, as all of you kind of like named, I think there's a lot of ways in which these biases are contributing to students not getting what they might need. All right. So besides the emphasis on risk reduction, the pathologization of autistic sexuality in particular, lack of LGBTQ inclusion, what are some other examples of professional biases in sexual health that you have observed, like in your own work, in your own life, any other kind of like biases that you kind of encountered? And what harm do you think these biases might cause people with disabilities? Again, you can unmute and speak or use the chat. I see there's been quite a few conversations in the chat. I think a lot of it is on the disability process. Thank you everyone for that. Okay. Is there any discussion on the impact of losing social emotional learning in programs in early education or in early learning environments in public schools as a method of improved social education programs? That wasn't something that I encountered specifically, but it sounds interesting if you want to share more about that. I do believe that there is a broad impact in integrated community education programs, and the loss of that in public education systems has extended impacts to all communities. I totally agree with this. The entire government, insurance, and research industry relies upon an ongoing supply of autistic or disabled people to serve, research, and exploit. So much funding goes to services or supports that don't actually improve quality of life, but maintain current structures of exploitation and subjugation of autistic people. Think of what we could do if more funding went to directly supporting people with disabilities, like basic income, etc. Yeah, I've oftentimes felt that it's pretty disheartening to see all of that, honestly. Comprehensive sexuality education, which includes information about relationships, consent, boundaries, communication rights, and self-determination, can itself be protective by increasing confidence and decision-making skills. Comprehensive education may help to reduce vulnerability to abuse while also supporting autonomy and healthy relationships. Yeah, I would agree with that. Teaching positive language is important too. The way we speak about ourselves and how we internalize bias is incredibly powerful. Yeah, I'm really interested in um an internalized sort of like ableism in sex ed. That's some like work I've done with the Catherine McLaughlin and the elevated training curriculum. Like I think I worked with them recently to create a new module, a new lesson that was on addressing internalized ableism in students specifically. I see a lot of bias around the definition of healthy relationships. Yeah, I've oftentimes sort of like felt like the way that that is framed can be, I'm not sure kind of how to describe it, but I know that like I've had some people in the community say that like it doesn't really feel good if you're told that all of your relationships are unhealthy because then where does that leave you if then you're alone? So yeah, I think I've had some kind of like feelings around that too. Impacted by an individual's lived experience. I apologize at the drop temporarily for another call coming in. Assumptions about a person's capacity for consent is one of the topics I see most often. I see that a lot. And yeah, that really bothers me, particularly because then it's sometimes used as a reason to not actually teach consent at all or to not offer consent in a way that's accessible. I also see, okay, in the response to bias to what a romantic relationship looks like, or even expecting people to want romantic relationships with their sexual partners. Yeah, I think I would agree with that. I think I'm understanding like your comment now more. Yeah, I think that there's oftentimes this sort of like a cookie cutter approach to you have romantic relationships and you have friendships and the two never mix and like actual relationships are far, far messier, and people have friends with benefits or romantic friendships or anything like that. And I think that it's important to remember that disabled people have the same range of needs around types of relationships as anybody else. And so it's important they get to learn about these types of relationships that don't necessarily fit into sort of a cookie cutter mold of what a relationship is.
Can I add to that?
Of course.
Just, you know, the idea that people, people
Hmm.
may decide not to have sex. They might decide to have sex, just like people with disabilities might decide to have sex. And people with disabilities are people, and that's the thing that I feel like have to repeat over and over. And so that means that there are people out there who are promiscuous and choose to be promiscuous and enjoy being promiscuous, right? There are people with disabilities out there who are promiscuous, who choose to be promiscuous, and who enjoy being promiscuous. And that is probably one of the hottest topics. And it goes into what somebody else said in the chat around consent and someone's ability to consent. So that's something that has come up multiple times over my career where someone's concerned that someone is sexually active, and they're choosing to be sexually active and they're choosing to have multiple partners. And is there having a disability impacting their ability to consent to that? I guess is a question, right?
Oh,
You know?
yeah. I mean, I wouldn't think it would necessarily. I mean, yeah, like it seems yeah, I'm not sure if you're asking like the question to me or just for like all the
It's
attendees, but
rhetorical, you know? I mean, it's just the
yeah.
question that comes up is, you know, and I really like Felicia's response. She said, just because we don't agree with their decision doesn't
Hmm.
mean the decision wasn't informed, you know?
Exactly.
And that's what we're trying to educate, right? That's what we're trying to make sure people bear in mind, but it comes up a lot, a lot.
Yeah, yeah. Yeah, and I think that this is something that I've heard from like other disabled people is wishing that they had learned more about like ethical non-monogamy earlier in their life. And it's like, do they get sex ed that talks about how to have conversations with your partners about like safer sex practices when they were multiple partners, or how to have conversations with about your partners about an open relationship, or like are they do they have access to that information about how to have those conversations and how to do that? Um, because I think that would be kind of like my question as opposed to kind of like, do they have the capacity to consent, but like, are we actually providing them information with about how to like have these conversations and negotiate, complexities.
There are resources out there, I'm happy to report, there are.
Yeah.
So there's like a
Yeah.
sexual inventory checklist that through Scarletine, and you can actually
Hmm.
analyze all of those things down to sensory. So it's coming, and it's great to see it out there.
That is great. Um, Gina says, some of this comes down to our puritanical society. We don't have these conversations with any people with or without disabilities. Exactly. Yeah. And I think that all too often, because people with disabilities oftentimes have more scrutiny over their lives, they're sort of like held to this sort of higher standard of being, or maybe not higher standard isn't the word for it, but they're kind of like expected to sort of conform to this sort of um, most sort of socially rigid model of relationships that like a lot of people might not actually be doing in their private lives. Amanda says, I live in Ohio, the last state to adopt sex education standards. Oof. Yeah, I live in Illinois, and it's kind of a funny state because we have, I think, like a requirement that if sex ed is taught in schools, it's supposed to follow the national sex ed standards, but also they don't have the, I think they can just opt to not teach it at all. And so um, it's sort of a mixed bag of what actually happens, is my understanding.
So I'm going to unmute and jump in here. I mean, one of the things that I think is coming up through this conversation is the fact that it varies widely between states. So the state where a person lives can have a huge impact on what they have access to. So, for example, here in Utah, right, the law says you can teach abstinence only. That we don't have sex ed in school at all. It's just abstinence. Whereas you go to another state, you might get a more comprehensive sort of experience. And so, there is a whole policy angle to this, which I think is also, informed by policymaker bias, professionals who are informing those policymakers and everything else that has a huge impact on, what opportunities and information are given to people with disabilities and family members.
Yeah, I would agree with that. I grew up in Idaho, um, which is also yeah, the school that I came from was abstinence only. But yeah, I would agree that like the biases of the people like making those policies definitely impacts everyone in those states.
I mean, the one thing looking at your question here that is driving me nuts recently is, the more that we are understanding and getting sort of the autistic perspective on some of these issues, the more we recognize that there are significant uh, patterns, right, around gender identity and everything else in the autistic community. Um, and yet we're not talking about that. We're not teaching it. We're not supporting it. Um, and yet there's a much, much higher rate of, um, you know, diverse gender identities among the autistic community than we see, right, in a typically developing community, which I think is fascinating and something that we should be talking about more and supporting.
Absolutely. Yeah. And like at this point, there's been quite a bit of research on that. A little bit less research on actually supporting LGBTQ autistic people, but getting to be more. But yeah, I think I wish that there was um that like curricula and so on that's made for autistic people was like more kind of like recognizing of the fact that this is like very solidly kind of like established in the literature at this point that autistic people much more likely to, and then someone said also like more into kink and sensory play. Yes, it's also like kind of acknowledging that autistic people are more likely to be LGBTQ, to be into like kink and other like sensory kind of like related activities, and to like include this in sex ed for autistic people. It's not happening, unfortunately, but like I would really love to see that happen. Um, we have a guardian here who is a Christian, and he has adopted a woman who's now in her 40s. She loves sex and picks up men at a local casino. She's had 5 babies and given up for adoption because she doesn't want children, but the guardian refuses to address birth control, and the state came in and attempted to support her to get an abortion, which turned out to be a holy war in court. She gave birth. Oh my goodness, I'm so sorry. Uh, no, yeah. I'm sorry that she's not able to get birth control. That's, yeah.
I don't want to jump in, but I mean, we had so I worked in Idaho for 12 years before moving to Utah here.
Mm,
And we had a similar case in Idaho where there was a woman who had intellectual disabilities, had multiple children, and it ended up as a court case as well because the doctors, after I believe her 6th child, chose to involuntarily sterilize her, um, instead of allowing her to, right, have that choice. She had her 6th child. The doctors knew her. It was a small community, and yeah, she underwent involuntary sterilization, without her consent and without any sort of support. So, and this stuff still happens, unfortunately.
mm-hmm. Yeah, involuntary, like a forced sterilization is still legal at a federal level, and so it kind of depends on the state that you're in as far as kind of like if it's legal by the state. Like in Illinois where I live, it is legal. In Oregon where I used to live, it's not legal. It sounds like in Idaho it is legal, but I'm not surprised having grown up there. But yeah, I think that's that the like Buck v. Bell that kind of established sort of like the precedent of like forcing disabled people to be sterilized against their will. That's still legal at a federal level, so it's still happening. There's one more comment in the chat. Within support systems for people with disabilities, especially for people with IDD, folks are taught to follow the direction of the authority figures in their lives. Teachers, paras, direct support professionals. This creates huge opportunities for exploitation and abuse. Our whole professional system teaches folks to comply. Yeah, I would agree with that. And that's one of the things I kind of want to address with my work is that type of thing. All right, so we have a couple minutes left. I want to go over some strategies for addressing these biases. So, strategies for addressing biases. And like I have links on like the next page to go over this. As well. So consider consulting the national sex ed standards when determining content for sexuality education for people with disabilities. Make sure that people with disabilities with diverse backgrounds are leading the conversations when deciding what is most important to cover. This is really essential for kind of like addressing and like preventing tokenization as well. And consider the use of theoretical frameworks such as crip theory, disability justice, and the neurodiversity paradigm for self-evaluation. So the National Sex Ed Standards, they don't cover disability in particular, but there is also like a link that I have here, the Comprehensive Sex Education for Youth with Disabilities. That's also published by SICAS that does provide some valuable guidance around disability-specific topics. And there was a study here that I have linked to, the middle bullet point that found that sex ed for people with disabilities is oftentimes inconsistent and doesn't always meet the national sex ed standards. And so I think it is really important just to kind of to look at those standards if you are in the position of developing a new curriculum. All right, so role of the disability community. So it's really important for people with disabilities and disabled people, diverse backgrounds, to be in leadership roles in determining how sex ed is developed, how it's implemented. I think it's also really important to seek out disabled people who are also sexuality educators and researchers, as well as the general members of the community. Like, there are lots of disabled people and people with disabilities that's kind of like what they focus their advocacy on, where that's like they're a professional educator or a researcher. And like avoiding tokenization is really essential. And so recognizing that people might have multiple roles is really important. And this is really, I think, essential for kind of ensuring that sex ed is kind of grounded in what the communities feel is important. All right, and then I mentioned using theory to evaluate your work. I have some links here where you can, and I'm sorry, Mindy, I added more links after I sent the slides to you, so I'll send the updated ones. But you can learn kind of more about crip theory, the neurodiversity paradigm, and disability justice, and kind of like how, particularly, I think links in here on kind of like applying crip theory and disability justice to a sex ed context. A colleague of mine from Cardia Services, if you're familiar with them, we are in the process of working on a disability justice assessment tool that you can use to sort of like evaluate a sex ed classroom environment. So we'll have that available eventually. All right, so we have a little bit of time left. We can either discuss a couple of questions here. We also I came up with some additional questions that I shared with Mindy earlier. We can talk about any of those in our last few minutes here. But which of these strategies do you think would be the most helpful for your work? What other strategies can you identify that might help with addressing professional bias in sexuality education? And then I have the questions that I had shared with Mindy ahead of time that we can discuss as well. Any ideas?
I was thinking if people are working on some responses, that's great. Um, if not, if we want to jump into some breakout session for a little smaller group discussion, we totally can do that. Um we actually used those questions that you sent, Morgan, to break them up into a couple different groups because they were all really great and there were so many of them. We were like, there's no way we're going to get to all these questions. So
I did.
we can break up into a couple different groups to do that.
Okay.
If you would like to do
Yeah,
that.
whichever. Yeah, however you want to do that is fine with me.
Okay. Well, if anybody has anything they want to share right now, that's great. If not, we can jump into Chris questions. I see
Oh,
Felicia has raised her hand.
Hi. So I'm just one of the things that like somebody mentioned earlier in the chat was around the fact that this isn't something that's just people with disabilities. This is just our society as a whole. And I found that like helping people connect to the ways that they also didn't get the information and education they wanted and also had unhealthy relationships because of that really helps frame that. And I also feel like it helps the people we're supporting feel like they're a bit more on level ground because it's like, this isn't just a thing that happens to you. Like friendship is just hard. We lost all our third spaces. It's not like just people with disabilities are struggling right now. They struggle more for sure, but this is a larger issue. This is a social issue. And when they feel like they have that personal stake, I think they feel a lot more comfortable with it.
thank you, Felicia. Yeah, I would agree with that. I think a lot of us probably came from, I mean, I mentioned like I know like for me, kind of like definitely coming from like a state where the quality of sex ed was pretty not great. I think definitely kind of like influenced like why this has always been really interesting to me, like even before like I identified as disabled for sure. All right. Well, we can break up into our breakout sessions. I will stop the share so people can do that.
Okay. Yeah, I'm prepared this time, you guys. I've got our breakout groups ready to go. So you will get moved into one and we will be in those groups until for about 20 minutes and then we'll come back and finish out our discussion here all together. There will be different questions in each group, so we'll have a chance to come together and share what we discussed. So, um,
Hey, Mindy,
yes,
do you know which group should do which questions, Group A or Group B?
I named the group, so I'm hoping what will happen when you jump into the group, you will see if you're Group A or Group B, and then you'll have the list of questions that are.
You're the best. Thank you.
You're welcome. Thank you. Thanks for sticking around, everybody. Here we go. Welcome back, everyone. I hope you had a great breakout. I know we did. Let's see. Okay. I'm hoping this is everybody back with us now. So, I took notes for our group, so I will share some of what we did and then I'll pass it over to the Group B folks. So in Group A, our first question was, in what ways could professional bias determine whether sexuality education is a tool of oppression or liberation for people with disabilities? We talked a lot about purity culture in our society and how that prevents comprehensive and shameless education about sexuality, making the conversation fear-based, and that sexuality for folks with a disability is a liability rather than a basic human experience. There was an example shared that among a group of kids with disabilities who came together to learn about sex ed, they found that the girls were taught risk prevention and boys just were not in general. So that was really eye-opening. And then we talked about how that is not different from just society as a whole in general, with or without disabilities. That's just what our society, how the bias that is happening in our country. Let's see. Boys and girls are not taught the same basic topics such as consent, relationships, risk prevention, bodily structure and function, pleasure, masturbation, family planning. All of that seems to be different based on gender, especially talking about people with disability as well. Let's see. Sorry, I'm trying to just figure out what I wrote. Our ableist conception of sexuality and even of reproductive systems, talking about like learning about menstruation. I think there was a comment, I don't remember the exact wording, but someone said boys learn about masturbation, girls learn about menstruation, and that's what happens and that's what is taught, sadly. The second question was, in what ways is eugenics, or the idea that some people, including people with disabilities, should not have children, present in modern approaches towards sexuality education for people with disabilities? And we started out talking about it's an undercurrent and it's reflected in the things that we don't teach. For example, just sex education in general. When people don't know how to reproduce, they can't reproduce. And that's kind of what we're seeing right now. Lack of sex ed for people with disabilities, family planning, even parenting. We talked about there's just not a lot of that education out there for people with disabilities. And not that it's like overtly spoken that is a form of eugenics, but really, what else is that? So we talked about that. The idea that if people with disabilities get pregnant and have families, they will pass along their disabilities, and framing that as a problem, right? That that's not what society wants, or that's not like the group of people that are encouraged to reproduce. which is terrible because then we talked about on the flip side, parents with disabilities can offer so much for children if they happen to have children with disabilities. They can help them navigate this world, help them prevent trauma that maybe the past generations have experienced. There was a comment in our chat, the blind should be leading the blind. And I love that because I think there's so much to that um, about parenting and just sexuality in general. Our last question, what impact could lack of information about pleasure have on people with disabilities? What messages are conveyed to people with disabilities by not including information about pleasure in sexuality education? We talked about people with disabilities can often feel that their pleasure doesn't matter or that it is wrong. And that idea can really impact people in the wrong way when they're navigating the world in general, when they're navigating relationships. Um, let's see, it adds unnecessary shame. Yeah, the paradox of their pleasure being wrong. And then we started to talk a little bit about how just America and the political kind of climate of today's of our country, how that is feeding into that and how it's very different than other cultures around the world too. So sadly, this is just kind of a problem that we are facing. Not saying that it can't be experienced in other places too, but it is definitely a problem we have here. And that's about it. Sorry, group, if I missed anything, feel free to maybe throw it in the chat, but those are the notes I took. So go ahead, group B, take it away.
I took notes for our group, so I'll try to be quick since I know we only have a few minutes left. But our first question talked about how the way we perceive our role as professionals influences the work that we do. And we talked a lot about how a lot of us as professionals, like social workers or working in human services, typically think like we are the professionals, we know best. And so we take our perspectives and put them as the foundation without ensuring that like the voice of the client or the people we are working with are heard. And something Alex said that I really liked was I'm the expert versus people are the experts of their own experience. So making that distinction. And then something that was really great about our conversation, we had someone saying that they are from Nashville and they feel like religion tends to kind of prohibit what they can talk about. And they really struggle with that. And so I feel like it really highlighted the purpose of this echo, which is like resource sharing, information sharing. So we were able to talk through different responses and kind of provide support there of, meeting people where they are and recognizing that our role isn't to fix, it's just to follow them alongside their journey. And then kind of building that trust and rapport for whenever someone is ready to talk about these types of topics, right? It's letting them know like what resources are available, being transparent about what your role is, and then just building that safe space where someone does feel comfortable. And also recognizing in Arizona, we had a member from Arizona who said they practice a lot of cultural humility and recognizing that people just do not talk about sex outside of their household or really at all in certain cultures. And so, bringing an ally that is a member of that community for trust building and support and really focus on the relationship building before discussing the issue at hand, because some people were never given this language. They were never given the opportunity to have these conversations outside of themselves or a family unit or in a way that was done in shame or around, with criticism, things like that. And then we talked about what sex ed topics we feel like are typically left out of sexuality education for people with disabilities. We talked about pleasure. We talked about kind of the wanting the social status of a partnership. So someone saying like, I want a boyfriend or I want a partner, and not kind of talking about what that looks like, what that dynamic entails in the long term. Talk about different kinks and like how to go about that and explore that, but also in a safe and comfortable way. And then different types of relationships, so non-monogamy or maybe someone who is asexual but wants a partner still. Um, and then even talking about how, not even talking about topics that are left out, but just people being left out of this conversation. They said in Arizona, They're not required to teach sex ed. They utilize an opt-in form, and those forms don't even go home to special education classes. And that they focus a lot on like abuse prevention without focusing on the healthy relationships piece, right? Teaching you like this is bad, but not teaching you, what dynamics and things they should be looking for in these relationships. And then also defining that healthy relationships apply to family members, friends, caregivers, like all types of relationships. And then even that these conversations need to start younger so that we can start just integrating it into education as youth are growing up and not looking back when they're older and people having this education for the first time. And then also the conversation that people can say no, even if it is a partner. We feel like in different cultures that might be a barrier where someone feels that they are expected to consent and say yes in a relationship. They see this a lot with one of our members who works a lot with immigrants. And so, yeah, and then we got to the last question very, very briefly, but um, talking about how lack of LGBTQ plus inclusion could impact people with disabilities, more likely to engage in risky behavior because they feel like they're not allowed to. And then it's such a risk for not helping people understand that it's okay to be a part of this community and what that looks like, what resources are available, things like that. So yeah, that's what we talked about.
Thank you so much, Erin. And thank you to all of you for sticking around with us to share during our breakout session. It's always so enlightening and so great to just talk with other people from around the country who are also experiencing a lot of these difficulties and a lot of this, I don't know, just like troubling stuff that's happening around this topic. So thank you so much for sharing with us and coming to engage with us as a group of professionals. We love it. We love having you all here. Our time is up. I just wanted to quickly mention that next month we will be taking a break, so we will not have an August session, but then we will jump right back in September. So you will be getting some emails. So come on back in September. We'll love to see you all. And thank you.
Thank you so much, Morgan. That was a great presentation.
Thank you so much. Thank you for having me. Glad to be here.
It
Okay.
was so great. Thanks, Morgan. And good luck with it's baby time now. Good luck.
Yes, I hope that goes well. And thank you, everyone.